When you visit a pediatric ophthalmologist's office, we are prepared to make your child feel comfortable. We check the child's vision. That's usually the first thing that we start with. We try to assess the eye movements and focusing capability of the eye. We look at the front structures of the eye and check the pupils. We also like to see if the child has normal color vision, if the two eyes can team and work together, if they have depth perception or binocular vision. Typically, we also look at how their eyes focus and work together, both in the reading position and in the distance position. Sometimes you have a nonverbal child, in which case we use different fixation targets or toys to look at, both up close and in the distance, to try to get an idea of what their vision is. After those preliminary tests have been done, and we look at the front of the eye as well, kids typically receive eye drops. And the purpose of the eye drops, which can sometimes be scary, but we try to introduce it in a very kind of gentle way, is so that we can look at the back structures of the eye, both inside the eye and at the back surface of the eye. We can also look at the focusing mechanism of the eye and determine, it helps us to determine in a very objective fashion if the child needs to wear glasses. And it's one of the most critical parts of the examination. The drops that we use make the child's vision blurry for about 3 to 5 hours, sometimes a little bit more, sometimes a little bit less, depending on the type of drop that we use. So that's another consideration. Sometimes they're a little light sensitive after the drops go in. They have some difficulties focusing and reading, and that can be a little bit problematic. So you wouldn't want to visit the ophthalmologist on the evening or the afternoon before a very important examination, which is going to happen the next day, if you have to study or you have a recital to give that night or you have a particular performance. So you might want to time it from that point of view, but in general, most kids do quite well with the drops and have little difficulty after getting them, except a bit of blurry vision, a little light sensitivity, and we typically give the kids some sunglasses to go home with so that they have an easier time of it and it's not so bright when they step outside.